You are welcome to my channel. Thanks for visiting, subscribing, sharing my presentations, and listening to this very one. Today, I'll be going through the list of available anti-malaria medications, or some call it drugs, or some call it agents. Artemisinin. These originated from China. It got to the other parts of the world in the 70s and 80s. And in that group will be Artemether, Arteether, Dihydroartemisinin, and Artesunate. Artemisinin mechanism of action. Artemisinins will bind iron and will break down peroxide bridges. That will in turn generate free radicals, and the free radicals will be capable of damaging the parasite proteins. Still on mechanism of action of artemisinin, they act rapidly with the fastest parasite clearance against gametocytes and erythrocytic stages of Plasmodium falciparum, Plasmodium vivax, Plasmodium ovalis, and Plasmodium malariae. Remember, I've stated earlier that the signs and symptoms of malaria will only show up during the erythrocytic stage, not the hepatic stage or the pre-erythrocytic stage. Artemisinin is very useful for severe malaria. Intravenous form for severe malaria in adults and children. There is a rectal form that is also available, and per oral form is also available. When we give any of the groups, we usually give it for 5 to 7 days. Artemisinin is generally well tolerated, but there may be type 1 hypersensitivity reactions or nystagmus or neutropenia. To eradicate Plasmodium completely, remember when I said erythrocytic stage is when there will be signs and symptoms of malaria, the hepatic schism, that is hepatic stage or pre-erythrocytic stage, should be cleared. That is, you are then attempting to eradicate Plasmodium completely. Then we have to give a long-acting agent after intravenous artemisinin. But remember, there's resistance to artemisinin in Southeast Asia. Notice, World Health Organization has placed a ban on the use of artemisinin as a sole or single per-oral agent. So, in many parts of the world, what you're going to find is artemisinin-based combination therapy. Now, artemisinin-based combination therapy. Examples are Artemether with lumefantrine. That is the one that is used mostly. Artesunate could be combined with amodiaquine in one tablet. That is the second to Artemether-lumefantrine as far as usage. You may have the combination of Artesunate and mefloquine in one tablet. You can also have Artesunate-sulfadoxine-pyrimethamine, or Dihydroartemisinin-piperaquine, or Artesunate-pyronaridine, which is a newer set. And this is very, very dangerous because this combination, that is Artesunate-pyronaridine, can cause severe hepatotoxicity. Antifolates. Plasmodium needs folate for its DNA synthesis, and the enzymes involved in this process is targeted by antifolates like sulfonamides, pyrimethamine, Proguanil, and Dapsone. You can find the combination of sulfadoxine with pyrimethamine. The brand name that is very common is Fansidar. And you'll get full information on sulfadoxine-pyrimethamine when you click on this link. These are two medications targeting two different enzymes in the same pathway. For example, sulfadoxine will target dihydropterate synthase, while pyrimethamine will target dihydrofolate reductase. The possible side effects of antifolate will include headache, bone marrow suppression, megaloblastic anemia, hemolysis in individuals with G6PD deficiency, hypersensitivity. Resistance to these medications by Plasmodium falciparum is very common in endemic zones. Another example is atuvacone Proguanil. You will get full information already published on my channel if you click on this very link. So if you want to know more about atuvacone Proguanil, that is Malarom, mostly prescribed for Westerners going to endemic zones as prophylaxis. So click here, you get full details. In nucleic acid replication, pyrimidines will be required. The two drugs above will target two different pathways in the biosynthesis of the required pyrimidines. Atuvacone will block the parasite mitochondrial electron transport chain. Also has mitochondrial membrane toxicity. Still on mechanism of action of Malaron, Proguanil will inhibit parasite dihydrofolate reductase through cycloguanil, that is the active metabolite. The side effects of atuvacone and Proguanil will include pruritus, vomiting, diarrhea, headache, abdominal pain, and of course, resistance to atuvacone component is pretty possible. Like I said, click on that link, then you get more info on atuvacone and Proguanil. Antimicrobial agents. Doxycycline has more or longer half-life than tetracycline. Doxycycline, tetracycline, or clindamycin could be used. There is less resistance to antimicrobial agents here when it comes to the use in malaria prophylaxis. Still on antimicrobial agents, clindamycin is not good for prophylaxis and can lead to C. diff, that is Clostridioides difficile, formerly known as Clostridium difficile. Some simply call it C. diff, diarrhea. Tetracycline should be used with caution, particularly in pregnant women and children. Why that? Tetracycline can deposit on growing bones. It should not be used in children. It should not be used in pregnant women, and it should not be used in women that are breastfeeding. Doxycycline can lead to esophageal ulceration and photosensitivity. Generally, there may be abdominal upset. Quinoline derivatives. Here you are going to find a whole lot of them, like Chloroquine, that is pretty common, amodiaquine, Quinine, Quinidine, Mefloquine, Primaquine, Lumefantrine, and Halofantrine. The 4-aminoquinoline. Here the examples will include Chloroquine, Artesunate-mefloquine, and amodiaquine. If you check my channel, I have published a separate full information on Hydroxychloroquine when it became drug of target in the early part of the treatment of COVID-19 virus. You can check my channel for that. Now, the chloroquine. Chloroquine is the first drug for both prophylaxis and treatment of erythrocytic stage. As a matter of fact, when I was in medical school, but resistance had developed in endemic zones even then. Formerly active against Plasmodium falciparum, Plasmodium ovale, Plasmodium vivax, and Plasmodium malariae. Remember, I just said formerly active because there are a lot of resistance right now against chloroquine. But later, resistance has developed against this medication with Plasmodium falciparum in many countries. It is still useful in the treatment of Plasmodium bovis, Plasmodium vivax, and Plasmodium malariae. Chloroquine can remain in the body for about 2 months. The common side effects of chloroquine will include retinopathy, pruritus, headache, bitter taste, on account of which many would not even like to take it, dizziness, neuromyopathy, and bone marrow toxicity. Chloroquine is given per oral or intramuscularly most times. Because when you give it intravenously, it will be too toxic. Most of us will never give it. Would never give it intravenously. Resistance to amodiaquine is possible as cross-resistance to chloroquine. Therefore, amodiaquine is combined with artesunate to make it more effective with synergistic effect. So artesunate amodiaquine combination is possible, and you should check my channel here for a full presentation on that. Now, 8-aminoquinoline. Here we have examples as Primaquine, Tafenoquine, and Pamaquine. Primaquine is the first of this group known as 8-aminoquinoline. It has unknown mechanism of action, mostly used for the prevention of relapse when it comes to Plasmodium vivax or Plasmodium bovis. It targets hypnocytes in the liver and gametocytes of the Plasmodium falciparum. Primaquine is very dangerous, particularly with effects on the heart. So you must have EKG before you start placing that man or woman on Primaquine for a long time. Why that? There is likelihood of prolonged QT and electrolyte anomalies. So let me dwell more on prolongation of QT and what the consequences could be. When there's prolonged QT, that may degenerate to tozadipone. If no correction on time, tozadipone may degenerate to monomorphic ventricular tachycardia. With that not being controlled on time, it can degenerate to polymorphic ventricular tachycardia. Without correction, polymorphic ventricular tachycardia can degenerate to ventricular fibrillation. Without defibrillation on time, there may be asystole. When there's asystole, either on the field or in the hospital, if it is in the hospital, code blue should be called. If it is on the field, then you call 911 immediately. So, if advanced cardiac life support system, resuscitation, and all the lives is not instituted on time, the individual could end up in the morgue, meaning dead. So, Primaquine can kill. It is contraindicated in pregnancy and breastfeeding mothers. Primaquine, if you are placing anybody on Primaquine, you need a low dose to anyone who has received artemisinin-based combination therapy. Okay, a single dose will handle the gametocytes and prevent relapse. Tafenoquine. This is a long-acting 8-aminoquinoline. This would target Plasmodium vivax hypnozoites. It is useful for prevention of relapse prophylactically in Plasmodium vivax and Plasmodium falciparum. Still on Tafenoquine, it can be used as anti-relapse at a very high dose of 600 mg start, that is given once. It has longer duration of action than Primaquine. The side effects is such that in anyone with G6PD deficiency, Tafenoquine should not be used. Now for Methanolquinolines. Here we have quinine, quinidine, and mefloquine. This can cause what is known as synchronism, meaning there will be tinnitus, nausea, headache, dizziness, disturbed vision, bronchospasm, flushing, and urticaria. For methanolquinolines is very useful in severe malaria. Quinine is given intravenously, not given bolus, please. Let me explain. When you want to use quinine, you can give it intravenously IV infusion, but never bolus. Okay? You can also give it IM, but we don't give quinidine intravenously anymore. After using these medications for severe malaria, you then switch to per oral. Then we continue the treatment with antibiotics like Clindamycin, Doxycycline, or Tetracycline. The side effects of quinine and quinidine are, but not limited to this, will be arrhythmias, prolonged QT. Remember, I've just given explanation as how prolonged QT could lead to toxicity point, ventricular tachycardia, ventricular fibrillation, asystole, and death. Hypotension, blindness, deafness, hyperinsulinism can lead to severe hypoglycemia in anyone on quinine or quinidine. Others in the list of anti-malaria will include Piperaquine, originally from China, that has replaced the Chloroquine, and when combined with Artemisinin, that is the Artemisinin with Piperaquine, it will have a very good effect on Plasmodium. Now, it has completely replaced quinine in Indonesia. So, to my listeners in Indonesia, you are familiar with Piperaquine. Still on some other ones, United States would not use amodiaquine for prophylaxis, and with that, they are pretty scared of the hepatotoxicity and agranulocytosis, and who will not be? So we should be very, very concerned when it comes to the use of amodiaquine for prophylaxis. Okay. Also, prophylaxis can target hypnozoids in the liver or the pre-erythrocytic stage. Is meaning the same thing, okay? Now, the schizoid in the liver or pre-erythrocytic stage will be dormant in the liver for several months. So, some of these medications should include those that will target that stage. If not, there will be relapse. Hepatic schizoids are better treated at quiet stage in the liver called the hypnozoids. Here, there will be no symptoms and it can last for several months. Primaquine is pretty good against those of Plasmodium vivax and Plasmodium ovale. At overcome, Proguanil is also good for hepatic stage, and amodiaquine is also good but less used because of the horrible side effects like hepatotoxicity and agranulocytosis. 8 Aminoquinolines can handle the hypnozoids of Plasmodium vivax and Plasmodium ovale, thereby preventing relapse. Now, investigational anti-malaria agents. If you just go through this list, you can pause and look at them. But let me quickly talk about macrolides and then vermectin. Vermectin has mosquitocidal effects. In conclusion, the above investigational drops and malaria vaccine, you can click on this very link to get full presentation on malaria vaccine. Someone will be asking, is that possible? Is that true? Is it false? I don't want to waste your time right there. Just click on this very link. You will listen to full presentation of malaria vaccine. So, both investigational drugs and malaria vaccine are the signs that the future elimination of malaria is probably remote, but it is feasible, meaning it is doable. However, prevention is better and cheaper than cure. So, if you want to know full info on prevention or malaria control, please, you can click on this very link. There you are going to get even how World Health Organization is also playing their own expected roles. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel. I appreciate it.